Awesome. Well, good afternoon, everyone. My name is Stephanie Davis. I am the Small Business Program Coordinator for the National Heart, Lung, and Blood Institute. So you've heard from several of my colleagues at the NIH, and I'm going to try to touch on the basics without boring you with details that you might have heard already. But just here's an overview of what we're going to be covering in this presentation. So we're going to be just briefly touching on the mission of the NHLBI, talking about what my office, the Innovation and Commercialization Office, does, talking about resources and support that we have for both small business and academic innovators, supplements to awarded grants through our program, as well as tailored innovator resources that the NIH offers. So briefly to just talk about the mission of the National Heart, Lung, and Blood Institute, as our name would suggest, we're a disease-focused institute, and we are specifically exist to provide global leadership for research, training, and education programs for the prevention and treatment of heart, lung, blood, and sleep disorders, and enhance the health of individuals so that they can live more fulfilling and longer lives. So we have 4 strategic goals at the NHLBI. The first is to understand human biology. The second is to reduce disease. The third is to develop workforce and resources, and the fourth is to advance translational research. So the NHLBI Innovation and Commercialization Office, and by extension the Small Business Program, we like to believe that our work is feeding into goals 3 and 4 of the NHLBI strategic goals. We are advancing translational research by funding small businesses that are developing new technologies, and by giving these companies this monetary support, we're also helping develop the workforce that is going to help continue the development of these promising new technologies. So the Innovation and Commercialization Office, our goal is to accelerate the translation of discoveries and innovations into new biomedical products that can be used to treat, diagnose, prevent, and research heart, lung, blood, and sleep disorders. So our goal is to basically cover 4 different goals. So first is we want to enhance the likelihood that the technologies that we help develop will impact patients. We want to provide educational opportunities and training materials for innovators in the heart, lung, blood, and sleep space, to broaden diversity and inclusion and the reach of the small business program, and then also create novel solutions to meet unmet heart, lung, blood, and sleep needs. And so we hope that basically by helping support the development of novel technologies for heart, lung, blood, and sleep disorders, we will be able to meet all of these goals. So our office provides support for not only small business innovators through the Small Business Program, but we also provide resources for academic innovators. So academic researchers who mostly focus on basic and translational research also have the ability to receive support through our academic proof of concept centers, such as the NCAI and REACH programs, which I will be talking about a little bit more later in my presentation. The Catalyze program, which provides funding for both small business researchers, small business grantees, and academic researchers, as well as the CapCat Center, which is funded through the NIBIB Point of Care Technologies Research Network. Through the Small Business Program, we have programs that specifically support commercialization and educate new innovators on how to translate their technologies. It provides funding opportunities to enhance diversity and inclusion within the Small Business Program, as well as additional follow-on opportunities to help commercialize technologies. And both of these communities are served by our team of advisory staff and entrepreneurs and residents. And these very intelligent and hardworking people provide advisory services. They help prepare companies for pitch coaching event. They pitch coach them in preparation for showcase events, and also connect them with members of our mentor network. So by supporting both of these communities, we are hoping that we are really giving these innovators everything they need to be able to translate their promising discoveries. So I know that many of you have heard from my colleagues about the Small Business Program, but just as a reminder, the NIH funds about $1.3 billion of non-dilutive funding towards biomedical technologies that can help advance the mission of the NIH. And so these programs consist of 2 sister programs. The Small Business Innovation Research, or SBIR program, which provides funding for small business concerns who are conducting R&D activities with the potential for commercialization, and the STTR, or Small Business Technology Transfer Research program, which is virtually identical to the SBIR program with a few key differences. Most notably, the STTR program requires that the small business concern have a partnership with a US-based nonprofit research institution. So at the NHLBI, we give out grants that are in phases, and the phases do not correspond to clinical trials, but rather focus on the stage of development for the technology. So phase 1 grants are usually, they're around $300,000 a year for a 1 to 2 year project period, and they focus mostly on early stage discovery and feasibility. Phase 2, this is usually a 1 to 3 year grant that is more around the $2 million mark, and this focuses on more extensive R&D activities, focusing on early stage manufacturing and scale up as well. And so, usually a company will apply for a phase 1 and then they will apply for a phase 2 grant upon completion of their phase 1 project. But we do have some additional options for companies that are a little bit more advanced, one of which is called the fast track. I call it the 2-for-1 special because they're essentially applying for 2 awards with 1 application package. A fast track awardee, if they get funded, will get their phase 1, and then assuming successful completion, they don't have to go through peer review again. They can just transition on to that second phase. And for SBIR applicants, they have the option to go directly to a phase 2 and skip over the phase 1 portion if they've already done that equivalent work with non-federal funds. And the NHLBI offers additional follow-on funding opportunities, which I will be going over in more detail later in the presentation. And then finally, the NIH and the NHLBI don't offer what's known as phase 3 funding, which some federal agencies do. That's where they act as the buyer. Basically, beyond the later stage funding opportunities, it is our goal that the companies we support will help partner with strategics and be supported by private capital to the point where essentially they don't need us anymore. So as I mentioned, the SBIR and STTR programs are more alike than they are different, but the key differences between the two mostly focus on the role of a potential academic partner. So SBIR awards permit partnering, but they don't require it. STTR awards require a partner between the small business and an academic institution. For SBIR grants, the contact PI, who's going to be contacted on all manners regarding the grant, has to be primarily employed by the small business at the time of the award. STTR grantees, the contact PI can either be employed with the small business or with the partnering academic institution. So this is a very attractive option for academic innovators. And then for SBIR grants, there is an expectation that about 67% of the work is going to be done by the small business in the phase 1 and 50% in the phase 2. For STTRs, there's minimum work requirements in all phases where the small business has to take at least 40% of the budget and the partner has to take at least 30%. In many cases, companies are eligible for both, but I strongly recommend reaching out to myself or another program director to see which mechanism would be best for you and your company. So just here is the application cycles. As a reminder, we accept applications 3 times a year during January 5th, April 5th, and September 5th. And so there is a delay between when you apply and when you can potentially receive your award. So just a reminder that in order for an application to get awarded, it has to go through scientific review and to the advisory council before we can potentially make a funding decision. And so here's just a brief overview of how the review process works. So as a reminder, for those who are unfamiliar, you are going to submit your grant electronically through grants.gov or through Assist, which is the NIH interface for grants.gov. It's going to get assigned to a study section that is going to review the application for technical merit and commercial potential. And then the reviewers will score your application, and these scores will be combined into a document called a summary statement, which you'll get back up to 1 month after the peer review group meets. So once you get your summary statement back, if you get a score that is considered within that fundable range, your application will be sent to the Institute or Center's Advisory Council. The council will then make funding recommendations, and after council meets, institutes and centers put together their funding recommendations, the company will get a notice of intent to fund if it is likely their application is going to get funded, and then they have to submit all of the necessary documentation through a process called just-in-time before they can get awarded. So just a reminder that this process can take up to, for anywhere from 6 to 9 months, assuming everything goes according to plan. So just be aware that there is a funding gap, and apply well in advance of when you're actually going to need the funds. So when your application is reviewed, there are several review criteria that are scored, and these include the significance. So, is this a real problem with an unmet medical need that has commercial potential? The investigator, there is more of a focus on the team for small business grants. Specifically, is this a well-rounded team with both business and scientific expertise? The innovation is this an innovative approach, and does it offer a significant advantage over the standard of care? For the approach, we want to make sure that it is a well-designed study that is feasible and has potential solutions to the pitfalls that might arise during the project, and the environment. So if the company doesn't have the facilities in-house, are they partnering with academic institutions or CROs who are able to provide those, the equipment and facilities needed to complete the project? And there are additional criteria that they aren't given individual scores, but they do factor into the overall impact scores, as well as some review considerations that don't factor into the scores, but they are going to be addressed in that summary statement. So the NHLBI Small Business Program, we're the 4th largest at the National Institutes of Health, behind cancer, allergy and infectious disease, and aging. And so we have about $130 million a year that we put towards promising technologies in our mission space. Right now we have a little bit over 300 active projects, and I've included a pie chart to show you what kind of technologies we fund. So about 1/3 of our technologies are therapeutics, which I'm grouping small molecules and biologics into the therapeutics bucket here. We're also very device heavy. So about 36% of our technologies are supportive devices, including both therapeutic and surgical devices. We also fund monitoring or diagnostic devices, in vitro diagnostic assays, imaging devices. We have a growing segment of digital health tools, and then the remaining 5% goes to research tools. But this distribution of technologies will vary every year based on what applications we get through the investigator-initiated funding opportunities. And just here's a brief overview of some of the diseases of interest within our mission space. So if it is heart, lung, blood, or sleep focused, we are probably going to be interested. I will offer one minor caveat. Malignant lung or blood disorders are most likely going to fall within the mission space of our friends at the National Cancer Institute. So for those of you who had a chance to hear Brittany Connor's presentation, if you're doing anything lung or blood cancer related, please go see her. But when in doubt, if you're wondering whether or not your project falls within our mission space, please ask me. I'm happy to point you in the right direction. So here's just a brief overview of some of the resources that our office, at the Innovation and Commercialization Office, provides for companies at different stages of development. And I'm not going to go into everything here because I'll be going into greater detail later, but as a reminder, we provide support through 2 primary mechanisms. The first is through grant programs, administrative supplements, and monetary support, and then the other way we provide support is by services, activities, and subject matter expertise. So through non-monetary and monetary support, it is our hope that we take these projects from the basic and early stage translational stage all the way up to the point where they are having a positive impact on patients and providers. So there are 4 what are called omnibus notices of funding opportunity that we accept applications through. So these are the ones that basically they are investigator-initiated funding opportunities. So when you apply to these, you're not applying to us, you're applying to the NIH, and if your application fits within our mission space, you will most likely get assigned to us by the Center for Scientific Review. But just a reminder, these are grouped based on whether or not you're applying for SBIR or STTR, and whether or not you're doing a clinical trial. And here is just a brief overview of some of the targeted notices of funding opportunity that we have at the NHLBI. These include both funding opportunities that maybe have their own set-aside bucket of funds and special review, as well as notices of special interest. And these NOCs aren't really funding opportunities per se, they're notices that are linked to the omnibus NOFOs, and they indicate an area of high scientific priority. So by applying through that, you're basically flagging your application as a way to show that it's an area of high scientific interest. So if you have an application that falls under a notice of special interest, I strongly recommend making sure you apply through that notice. So the one program I wanted to specifically highlight is our Phase 2B funding opportunities. So I mentioned earlier in the presentation that the NHLBI provides additional follow-on funding opportunities for later stage companies after the Phase 2. So different institutes and centers offer Phase 2B programs. Some do through the omnibus. We have our own RFAs. And these programs are specifically designed to provide innovators who are developing technologies for heart, lung, blood, or sleep disorders with additional funds that are needed to attract private investors and meet their regulatory milestones. So the Bridge program covers pretty much anything in our mission space, but the Small Market program is specifically designed to cover technologies that address either orphan indications or pediatric indications. So if you're doing something in the rare disease space or for a pediatric population, I strongly recommend looking into the Small Market program. But otherwise, both of these programs provide $3 million over 3 years, and there are matching funds expectations. The reason for this is because at this stage, we're trying to help our companies attract private investors to the point that they don't have to rely on us forever. So for the Bridge applicants, it's expected that they bring in an equal amount of matching funds. So if they request $3 million, we want them to bring in $3 million. For small market awardees, there is a lower match requirement. So if they ask for $3 million at the NHLBI, we want them to bring in $1 million. And we try to fund about 5 Bridge awards and 2 small market awards every year. And these RFAs have special due dates. So they're not the omnibus, January 5th, April 5th, September 5th deadlines. The next due date for this is February 28th, 2024. And we try to have the applications accepted every February, where they will get reviewed in July and hopefully funded at the end of the year. So we have an informational webinar coming up very soon. So if you have had a small business Phase 2 grant, it doesn't even have to be through our institute. It can be another NIH institute or another agency. As long as the project fits within our mission space, you might be eligible for a Phase 2B award. So just if you're interested in this program, please feel free to click the QR code to register. And so, as I mentioned earlier in the diagram, we have other funding opportunities and programs that can specifically help our companies with their product commercialization, for enhancing diversity and inclusion, as well as providing resources for very, very early stage product development, often for academic innovators. And then, of course, we have advisory services provided by our entrepreneur in residence team. We have another program that we recently started doing with the National Cancer Institute called Connecting Awardees with Regulatory Experts. So this program is specifically for companies that have an FDA-regulated technology who haven't previously met with the FDA yet. So basically, companies can apply by submitting an application as well as questions that are relevant to the FDA. And we will work with our FDA reviewers to provide the answers to these companies. And so right now the program is open to past and present grantees through the National Heart, Lung, and Blood Institute. So the application deadline is coming up very soon. We're hoping early spring. But if you'd like more information, this is a program started by our friends at the National Cancer Institute. So the URL for their website is listed at the bottom of the slide. So the I-Corps program, I'm sure many of you in the audience have heard of the I-Corps program, specifically the NSF program that has the I-Corps nodes that community innovators can participate in. Well, we liked the I-Corps program so much that we decided to take the best parts of the NSF program and make one that was more specific to biomedical innovations. And this program is called I-Corps at NIH, and it has been around since 2014, and it provides early stage fast track or Phase 1 grantees with the ability to basically get a crash course in customer discovery. So companies are, like the NSF program, required to complete 100 interviews or more over an 8-week period, with the idea that the input received from these interviewers will help solidify and refine their business plan. So this program, we offer 2 cohorts a year, and we have the next cohort is due on January 31st. So if you have a company that is currently getting a phase 1 award through the NIH, this is a great program. I would strongly recommend looking into it. And some institutes and centers participate in the National Institute for Biomedical Imaging and Bioengineering, C3I, also known as the Concept to Clinic Commercializing Innovation Program. So this is a program that offers entrepreneurial guidance and education to innovators who are developing novel medical devices. So the NHLBI participates in 2 of these programs. The first one is called the EC3I program. This is kind of like the C3I Junior program that is really good for academic innovators who are funded by R01s and other research project grants who maybe don't have as much of a business background. But this is a virtual course. It's 10 weeks long. And it provides a very good introduction for the main C3I course, which is a 24-week curriculum broken into 2 12-week segments. So the C3I program is the one that's open to small business grantees, but we have also had companies participating through other translational programs participate in C3I as well. And companies that receive grant funding through both the NIH and the NHLBI have the option to request a limited amount of funds to cover activities that fall under the technical and business assistance umbrella. So not R&D activities, but things such as sales assistance, market research, regulatory plan development, manufacturing plan development, access to technical or business databases. All of these things fall under the TABA umbrella. And so at the NHLBI, we have, companies can request this in their application. They also have the ability to participate in the NIH-wide TABA programs, which for phase 1 companies, that is a needs assessment program that essentially will provide a company an overview of where they are riskiest and where they are, basically, which areas of product commercialization require de-risking and maturity. And then the TABA Consulting Services will provide phase 2 awardees with up to $50,000 to select a vendor that can provide business, regulatory, IP, or reimbursement support. And another program that I am a huge fan of at the NHLBI is the Small Business Diversity Supplement Program. So a lot of companies that are grantees, they ask about this program because they haven't really heard of it before. But it's a really great way to hire a new candidate and bring on new talent to your company while also enhancing the diversity of the scientific workforce that the small business program supports. So the candidates that are supported for this program can get scientific training, entrepreneurial training, and real-world experience in the private sector. So it's a great way for new graduates of master's and Ph.D. programs, as well as postdoctoral scholars, to break into the private sector and really get a crash course in biomedical entrepreneurship. So companies that apply for this supplement can get support that covers the candidate's salary as well as a limited allowance for travel and supplies. The companies have to have an active small business grant in order to apply for this. The candidate must be a US citizen or a permanent resident. But we've had a lot of companies bring on very valued members of their teams through this program. And it's really something that I think everybody wins. The candidate gets experience, and the company has a talented new member of their team. So another program that we have for companies that are unfamiliar with the Small Business Grant Program but have promising technologies is called the NIH Applicant Assistance Program. So if you are or know anybody who is interested in submitting a phase 1 grant, this is a really great way to become more familiar with the grant submission process. Companies that are selected for this program will get 10 weeks of free coaching, and they will be connected with a mentor who's going to help them with their application submission. So we have a next due date for this is in May 2024. We're still getting the final due dates down, but if you know anybody who's interested, or if you yourself are interested in, this is a really great program that can provide a lot of education and support for new applicants. And we also started participating in a new program that's sort of similar to the AAP, but has some different characteristics called the Innovator to Entrepreneur, or ITEP program. So the ITEP program is a little bit longer. It's 5 months long, and basically it's designed to help support the transition of academic innovators or inexperienced innovators and help them become more experienced entrepreneurs who have well-written and competitive applications to the small business program. So this also supports companies that are submitting phase 1 applications. Here's the eligibility. As long as you have not previously received a small business grant, you're a relatively inexperienced entrepreneur, we encourage you to apply for this program. So there's going to be 2 cohorts a year, and applications are accepted on a rolling basis. And I've included the link to the ITEP website at the bottom of this slide. So our office, as I mentioned, we have subject matter expertise in entrepreneurs and residents that provide innovation and support services for our companies. So in addition to providing them with money, we can also help them through things such as one-on-one consultations. We have a great team of EIRs who can provide companies with answers to their questions, focusing on regulatory affairs, clinical trial design, reimbursement, fundraising, health economics, their commercialization and business development plans. We also have a mentor network, which includes individuals who are not employed by the NHLBI, but have expertise in device and product and drug development, who could provide their wisdom and expertise with our innovator community. So we recently launched a mentor webinar series that provides tailored educational content that leverages the expertise of this mentor network. Additionally, we provide companies with registration and attendance at several of these pitch coaching. We provide them pitch coaching so they can attend investor showcase events. So a good example is that the January Resi, which was held just this week, as well as the Biotech Showcase, we had our EIRs provide coaching for some of our companies to attend these events, give their pitch presentation with the idea that they would potentially meet with investors and strategic partners and help make those valuable connections that are really going to help advance their project. So here's just an overview of the entrepreneurs and residents that provide advisory services to our grantee community. And so out of the team of 5 that we have, they provide expertise in things such as regulatory strategy. We have a patent attorney who provides IP expertise. We have Dr. Steve Flame, who is our investor in residence, who's provided pitch coaching for a lot of our companies, as well as advice on how they can make themselves more attractive to investors. Renee Arnold is our health economics and outcomes research expert, who also has additional expertise in reimbursement. And Dr. Kim Martin is our clinical trial design subject matter expert. And so we have ad hoc consultations with these EIRs. We also recently launched a monthly series called BioMedTech Connect Office Hours, where companies can sign up for very, very short sessions with our EIRs and get their questions answered quickly and efficiently. So here's an example of one of the companies that actually presented this week at the Biotech Showcase. So we have Calisite Incorporated. So they are a Baltimore-based company that is developing a shelf-stable red blood substitute called erythromer. So they have really leveraged a lot of resources that the NHLBI and the NIH have provided. So in addition to providing, they've received several grants through us. They are currently completing a Phase 2B Bridge Award. They've also participated in things, additional training programs such as the Commercialization Acceleration Program, which was the predecessor for the TABA Consult. It was the old TABA program for Phase 2 awardees. They have gotten several one-on-one consults with our EIR team. They've presented at many investor conferences, and so that has really kind of helped them make connections with investors, as you can see in the far right portion of the slide. So it's not required that companies participate in all of these resources. They are absolutely free to just take the money and go do with it what they will. However, we have these services for the benefit of our grantee community, and we've seen that those that really leverage the resources that we have seen fantastic outcomes. So in addition to providing small business grant funding, our office also originated the academic proof of concept network that is currently in place. So first we started with the NIH Centers for Accelerated Innovation, which provided support for academic innovators developing new technologies for heart, lung, blood, and sleep disorders. That led to the creation of the Research Evaluation and Commercialization, or REACH hubs, which they started in 2015. This map shows the location of some of the more recent REACH hubs. We also have 5 new ones to add to this map, which haven't been added yet, but I'll show you those in a few slides. And then also the National Institute for General Medical Sciences has a partner programming called IRED. And so this is very similar to REACH. It provides entrepreneurial resources and development opportunities for innovators who are in what are known as idea states, so states that have lower than normal levels of NIH funding. And so together, all of these hubs provide a really excellent support system for early stage innovators who are trying to develop their technologies and get them to the point that they might be competitive for a small business grant. So just here's a brief overview of what we've seen thus far from the NCAI and REACH programs that were started by our office. So by providing small, very kind of like mini grants for early stage researchers, as well as educational coaching, personalized feedback, and training and resources, we've seen some really great outcomes. So over 125 startups, about 435 projects, over $2 billion in follow-on funding, and over 3,000 academic innovators trained. So not too shabby for a program that just started off trying to educate academic entrepreneurs about product development. And this is actually the latest bunch of REACH hubs that were just awarded last year. So we have one in the Mid-South, we have one in Texas, we have one in the Mountain West and Pacific Northwest region, one in Chicago, and one in the University of Maryland area. And another program that we find is very useful for our small business community is called the Catalyze program. So Catalyze covers a lot of similar activities to the small business program, but there are some key differences. There are different eligibility criteria. Both academic innovators and small businesses can apply for Catalyze. And companies that get support through the Catalyze program are also, they have a lot of support that is provided through our Catalyze Coordinating Center. But the end goal is very similar. We want to develop new technologies for heart, lung, blood, and sleep disorders. So we have 2 main areas of support for the Catalyze program, the first of which provides funding opportunities for product definition, and then the second half provides support for preclinical services. So here are just the examples of the product definition funding opportunities. These are open for both small businesses and academic innovators, and we have many companies that have gotten support through both SBIR and Catalyze. So if anyone has any questions about these, I'm happy to connect you all with the Catalyze Scientific Director. And if you'd like to connect with us, I strongly encourage you to follow us on Twitter/X at NHLBI SBIR. Our main inbox is NHLBI_SBIR at mail.nih.gov. And if you want to get updates from our office, the newsletter is great. It comes out every month, and it talks about funding opportunities, opportunities for new entrepreneurial training programs, and just items of interest if you want to stay up to date on all things happening in the INC office. So I want to thank you all for your attention today, and I'm happy to take any questions.
So one of the things you mentioned is minimum requirements to be done of work to be completed now for grants.
Yes.
Small organization, a lot of what we're going to do is contracted with various firms and the like. So
yes.
how do you look at situations like that?
That is a great question. So, and that's one I get a lot. So new companies that don't have their own facilities and resources often will rely on CROs and fee-for-service providers. Generally speaking, we consider those to be small business costs. We don't consider those to be outsourcing. But by contrast, if, for example, if we have a company who's collaborating with an academic institution and that academic institution is going to have a PI on the grant and they are going to have significant input into the direction of the project, then that would be considered outsourcing. But CROs and fee-for-service providers that are going to be providing services at the direction of the company, we don't consider that to be outsourcing. So that doesn't count towards like the 33% phase 1 SBIR outsourcing maximum. All right, looks like I must have answered all your questions. Thank you. Oh, and if anybody wants some literature, I have some handouts, so please come see me.